Now, a breakthrough in the treatment of sickle cell disease could mean the difference between life and death for millions of people around the world. US-based Dr. Sota Omoigui, a revolutionary work employs a preventive approach using home oxygen therapy for patients. Arise correspondent Turaya Farouk reports.
Imagine a world where sickle cell patients can live without the constant fear of crisis and pain. Dr. Sota Omoigui's pioneering research has made this a reality. The conventional approach and what hospitals around the world do currently is called the MAD paradigm. It focuses on treating patients in hospitals after they experience an irreversible sickle cell crisis. But this often leads to severe pain, cell damage, multi-organ failure, and in many cases, death. Dr. Sota Omoigui has a different approach. His revolutionary at-home oxygen therapy champions preventive measures tackling crises before they begin.
So the solution here is to prevent the crisis so the patient does not even get to the hospital, the cells do not even die.
In his research, within 30 minutes of the onset of a crisis, in what he calls the golden half hour, the sickling of the red blood cell is reversible by inhaling oxygen or reoxygenation.
The reason why modern medicine missed this solution was that by the time patients got to the hospital in a crisis, they were already in an irreversible sickle cell crisis. Their cells could no longer be restored by oxygen. So doctors thought oxygen did not work.
It's a shift from a reactive treatment approach of the last 100 years in modern medicine to a preventive approach. Patients and physicians are empowered with knowledge to predict and manage the disease. Some medical practitioners have adopted this new initiative in their clinics, citing the remarkable effectiveness of the approach in their patients.
If you're a scientist and you understand the rationale for the use of oxygen in the first 30 minutes of a sickle cell crisis, every last one of them recovered. Many of them without any other treatment, just oxygen, and they're better and they go.
I've not seen them back in my office anymore since they acquired the oxygen. They'll not be coming for hospital visit. I did it, visited myself. They did it at home. Okay, it's a home administration. Okay, so they administered there and they called me and they are very happy about the whole situation. I've never had any results in management of patients, as much as what I've had with this, home oxygen therapy.
The procedure allows patients to manage their condition from the comforts of their own homes through the use of an oxygen concentrator or a cylinder. His research has shown a significant reduction in sickle cell crisis with a 90% effectiveness rate.
0% hospitalizations, and that right there alone was amazing because it really is, it's just really, it's not okay, and it's painful and it's heartbreaking. And not only have we had less challenges, no challenges, because the oxygen concentrator works and I got a backup just in case, I feel more confident. Seeing her be able to go from 45 days of missed school to 15 days of missed school and, seeing her be able to get back in there in school faster and not have to overcome such a big hurdle, I'm coming back after weeks or coming back after being in the hospital. Seeing her jump right back in there, a lot of pride. And as a mother, you can try to fix everything, and I can't fix that. So it's been heartbreaking to me to see that and to see someone I love melt away from me.
Within 1 hour, 30 minutes of being on oxygen, the crisis went from a 7/10 pain to 1/10. So I was really shocked that, okay, what is this discovery? This is magic. I was not given any pain reliever, no fluid yet, just the oxygen. Since I got the oxygen concentrator, it really helped me to relieve stress. I have better quality sleep. because I use them when I want to sleep. It has really helped me. I've not had crisis since then. It's been 4 months now. Yeah, I've not had crisis since then.
This groundbreaking discovery is set to revolutionize the treatment of sickle cell disease. By adopting this preventive measure, patients with sickle cell disease can experience improved outcomes, reduced hospitalizations, and an enhanced quality of life. Thuraya Farouk, Arise News.